this is part of a much larger project. I'm speaking about a particular aspect, which is about the role of engaging with communities and the implementing agencies as part of this evaluation process. I wonder if I can make this bigger. I can't really see my own writing on the screen. Okay, let me try. Okay, so very briefly, I'm going to go through. Is it possible to make that bigger?
Yeah.
Thanks. Okay. Thank you. By way of background, there are two important overarching strategies or methods in the province that I think I need to touch on very briefly. I'm going to give you an outline of the methodological approach to the project, but then I want to speak a little bit more about the community engagement in the research process. So the first of the two overarching strategies is this integrated violence prevention policy framework, which is something that was adopted by the Provincial Cabinet in August 2013. I've heard some talk of this today in the session I attended about trying to broaden the safety perspective so that it's not just a criminal justice one. It fits very neatly with what's in the policy framework, which blends a public health approach with a whole of society approach. It stresses evidence-led interventions, and so part of that, and I'm not going to read through the whole list, but things such as safe and stable and nurturing relationships between children would be one of the important things to put in place to achieve a long-term, safer and less violent outcome, I suppose. Other important aspect of the policy framework is its reliance on surveillance data or good quality information from high-risk areas to actually monitor and assess the effectiveness of various strategies that are adopted. And the second major aspect, and this is a City of Cape Town competency essentially, is violence prevention through urban upgrading. So there's a real convergence between what the policy framework is speaking about and the approach being adopted by VPUU, which is one of urban upgrading, but also embracing a whole of society approach. A public-private partnership which was started in Khayelitsha but expanded to several other communities across Cape Town. I think the pictures, if you've been to a VPUU presentation where they outline what they've done, this is the graphical representation of it. So this is a before shot of a high crime area. This is what it looks like afterwards. There's a VPUU can do this justice, and I did see Ntutu somewhere in the room that could maybe answer more questions about the detail of VPUU, but that's not the subject of this presentation. I think I just need to stress, though, that that physical aspect is just one of the three tiers that they use. So the built environment is the bottom right there, which fits in with their situational crime prevention focus. They also look at institutional crime prevention and governance, and also the social crime prevention aspects. So all very complicated and complex and involving different intervention layers and different groups at risk and working with the community. So it's quite an inclusive process, and it coheres very closely what the provincial government was doing with their integrated policy framework. So the challenge for us is really how to evaluate this, and there's quite a lot of literature on how complicated it is to evaluate these types of multiple intervention programs with all sorts of things influencing outcomes at the same time. I'm not going to go into too much detail about the method or how we're trying to attempt that. I want to emphasize the community engagement process, which is emphasized in both the policy and in the VPUU methodology as one of the key aspects that needs to work simultaneously with the research. The idea is that it fosters ownership, effective implementation, and sustainability. But one key aspect that I think needs mentioning, and that is the policy framework speaks of a whole of society approach, but it's really a whole of government approach. And so the opportunity, that's a particular problem in the Western Cape, where the areas that they're intervening are actually not situated in provincial government strongholds. And so there's an opportunity in working with VPUU to work with an agency that has existed beyond the current government's life cycle. So VPUU was established before the current government was in place, and so there's an opportunity essentially to work with the whole of society that might not have been there previously. Of course, that makes things difficult for us as researchers, because while we need to consider the VPUU process and how they engage with communities, it also makes things complicated when they're the agency being evaluated and they're, in essence, a gatekeeper. So just to bear that in mind as I proceed. Methodological approach I'm going to go through very briefly, but essentially we're trying to build indicators for 4 or 5 different domains, and they're listed there: youth development, safety and security, economic and human development, alcohol use and infrastructure, the last 2 because those are the interventions that we are trying to evaluate. Data sources, obviously there's a lot more to this, but the ones I wanted to highlight, there's a cross-sectional study of injury data that we conduct every 6 months, and we collect 1 week of trauma, so we have a kind of a heat map or an idea of how the trauma and injury pattern is changing over time. There are alcohol household surveys, there's liquor outlet mapping. We engage with qualitative work with key stakeholder groups as well, and then we try and access secondary data, either from VPUU, crime data from the police, census data, and so on and so forth. It's not a data source, but important to note, where possible, we try and geolocate things. So we can try and have a similar sense of where patterns and covariates are changing over time. So I'm not going to go into that in detail either, but there's a lot of work happening with geographers. What we did to progress this was get a research partnership going with our junior research staff, placed part-time within the implementing agency. The benefit for VPUU, obviously they get an opportunity for research training and capacitation of the people they're working with, and access to technical research support. From our side, access to the data that VPUU have been collecting as part of their ongoing M&E, and also access to their network of community stakeholders. So I wanted to speak about 3 aspects revolving around with the community engagement. The first is the health facility injury data. Just to give you an idea, we're collecting a single week of trauma. And the aspect I mentioned that's very important is that we allocate that trauma to very small sub-areas. And those don't exist it doesn't exist in the normal geography. When you ask, if you had to ask a police officer or service provider where something was occurring, these boundaries don't cohere at all well with official boundaries. What happened before we began this work was to work with VPU's network of stakeholders and the communities to try and define what they understood as neighborhood level boundaries, which are the smallest defined areas that people can reliably say, I got injured in this place, I got injured in that place. So it's a very useful building block to actually look at injury patterns and how they change. So that was the first community engagement aspect of the study, very positive and very helpful. Obviously, these results are reported back to the facility managers, they reported back to the community stakeholders and the project partners. The second aspect of community engagement I thought I'd speak a bit about is the household survey. This is a snapshot of the houses so again, just a bit of geography and where we did our sampling. We collected data from 1,500 addresses in Khayelitsha and Gunya, which is an amalgamation of Gugulethu and Nyanga. 2 questionnaires, one administered to the head of household, and the second a subset administered to young adults in a particular age range. It's a subset of about 300 young adults where we asked additional questions. So that's a simple overview of the logistics. However, the process of setting up that survey was markedly different in the 2 communities. Khayelitsha, and where we worked with the Khayelitsha Development Forum, things were much easier. And then in Gunya, where we worked with the SNAC stands for the Safe Nodal Area Committee. I'm just going to call them the SNAC because it's much easier going forward. Things were very different. So in Khayelitsha, I'm going to skip the last aspect. In Khayelitsha, it was quite straightforward. We subcontracted to a survey management company, which brokered permission with the local community representatives. we got a quick and easy endorsement, but the problem actually came much later, where we had a problem with field work, which was poorly supervised. So we took a different approach in Gunya, where we wanted to manage the research ourselves. And what happened after that is that employment quickly became a contentious issue. The SNAC wanted the field workers from their own area appointed. They conflated the researchers with the implementing agency, which was VPUU, which was very difficult, and we had a big impasse, and it was only resolved when VPUU managed to broker a deal. We actually had to threaten to withdraw at some point, and only after that were we able to proceed and get permission. Fieldwork supervisors we were able to appoint, but the field workers were recruited from a local council database. And at that time, the SNAC became suspicious as to who was administering the database, who gave permission, and so on and so forth. So there was another impasse that we had to resolve. There was a positive aspect. So once we had the SNAC on board, we were able to engage with them to help resolve some security issues and safety issues that arose. And by and large, VPU's engagement in trying to resolve this issue was very helpful. I was going to touch on a third aspect, which is training and capacitation. I'm not. Just suffice it to say there's been quite a big skills transfer as part of this process. And this is the last slide, just key observations. The first point really is that this engagement has got a number of, with implementers, community stakeholders, and researchers, has a number of benefits. But we also need to recognize that working in environments with multiple gatekeepers is extremely complex. So having access to appropriate representative bodies is very helpful, but when those representative bodies are new, it can be quite unpredictable. And also if the implementing agency is at odds with one of those community bodies. So I think the take-home message is that it's imperative that the communities are easily able to differentiate between implementers and researchers. Thanks.